They completely shut out Republicans from the process. The bill was essentially drawn up in Speaker Pelosi's office. They used political buyouts for, obviously for the Senate, some more subtle in the House, but it was one of the biggest political processes you've seen up here in a long time. Just think what happened with Bart Stupak. Held his ground for a long time, and then through a political process of an executive order, which was toothless, he caved in. And it's unfortunate for him, it's unfortunate for the country, and it was a very political process that I think has left us wanting for more clarity in how we make laws here in America. The healthcare law raises the cost of healthcare in America. It fails to address the cost centers, which we could have done to reduce the cost of healthcare in Americans, something that we proposed as Republicans. I contributed to a bill and supported H.R. 3400 that was judged by the Government Accountability Office to reduce healthcare costs by 10% for everyone across the board in America. And that's what we should have been doing. We had the opportunity. But what Obamacare is going to do is raise the cost of healthcare, raise the premiums, and force us into a rationing wait system where we have to be in line. Americans don't like to wait in line. We hate to be in line for our driver's license, to order food, and even waiting at the doctor office now because of the volume, we sometimes sit there for 60 minutes. Our new wait period will be like 6 months as this continues to move more and more towards a bureaucratic healthcare system. And I think that's the real danger here, is that we're taking the free market out of healthcare. And when you do that, the responsiveness to us as consumers leaves as well. And we see this in other forms of the government where they take over the process of providing services to us. It's going to be tremendously expensive in that we haven't reduced the cost for medical malpractice insurance. In fact, we've raised it. It's going to be expensive in that we have now taxed the products that are used to help us, the materials, the heart valves, the hip replacements, all those are now taxed, higher cost. It's going to cost us more in the form of lost jobs because of these higher costs. Capital is a coward. It only goes where it's welcome, and higher healthcare costs drive jobs off our shores, off our borders. So we have a tremendous cost ahead of us in healthcare unless we reform and repeal what has been passed. And I think we can. I think Americans are in the mood for that. And right now this cost, there are 52 programs that are not funded. 36 of them are open-ended. In the law it says such sums as required. We had a meeting, a committee meeting, and as the ranking member of the Labor, Health, and Human Services Subcommittee of Appropriations, I was able to ask Secretary Sebelius, when will the President submit a supplemental budget to cover these programs that are not listed in the budget, these costs that are not in the budget? She informed me they have no plans to submit an additional supplemental budget. I turned to the chairman, Chairman Obey, and I said, where are you going to get the money for these programs? And he said, Todd, not only do we not have the money for these programs, there's another $17 billion that they took out of student loans that he can't replace. So the cost of this is going to go up as time goes on. And then when these programs finally get funded, once again, it'll bump the cost up. So we have created a terrible mess for America financially. Not only are we going to wait in line, we're going to pay more for our health care. The Tea Party movement has played a tremendous positive role in the healthcare debate. They were here at the Capitol. I went out and spoke with them. I met with members of the Tea Party across the state of Kansas. I had more than 20 healthcare town hall meetings myself in places where my Democrat colleagues would not hold healthcare town hall meetings. The Tea Party's presence there was also very powerful. They want to bring clarity to this issue, to the process. They want to bring the cost down. They want to keep Americans in control of the healthcare system and not the government. So I think they were very helpful in the process of battling this, and I think they will be instrumental in replacing the current system as we repeal parts of it. I've met with over 300 physicians now about this. Many are considering early retirement or pursuing some other means of making a living. 42% of our physicians no longer take Medicare or Medicaid patients because they can't afford to. So we are seeing a form of rationing now already from the law. And it's a sad thing. But I think Kansans are worried that we are going to lose their freedom, that we won't be able to choose our physicians, that our wait times will be longer, and they want to see this repealed and replaced. I mean, it's huge, the number of people. Those that think that this is a good deal are very small in numbers, and I think have some illusion that it's actually going to improve health care. I see no benefit in what health care reform has done.